make you feel totally disconnected from your body, from your surroundings. It can send you into this really introspective, almost dreamlike world.
Right.
We're diving into ketamine today. It's a drug with some, well, pretty surprising applications. We will explore its unique effects, how people use it, and importantly, some critical study info from the sources we've looked at.
Yeah, absolutely. Ketamine, it was developed back in the mid-60s, actually. It's what's called a dissociative drug.
Dissociative, okay.
Yeah, known for really powerful pain relief and anesthetic properties. I mean, besides its common use in veterinary medicine, you find it used therapeutically now, too.
Right.
And, of course, psychedelically and recreationally. It usually looks like a fine white powder, sort of crystalline, or sometimes it's in liquid form.
And that profound disconnect you mentioned, people often call it the K-hole, right? That's not just like a casual term.
No, not at all.
It sounds like a really intense mind-body split, maybe with visuals, feeling kind of set adrift. What exactly causes that state, and how fast does it kick in?
Well, it varies quite a bit, actually, depending on how it's taken. The common ways are snorting it,
Okay.
usually around 15 to 60 milligrams for a dose that way, or injecting it, either IV or into the muscle. Sometimes, though less common, it's taken rectally. Shelving is the term used there.
Gotcha.
Now, if it's snorted, you're typically feeling the onset in about 5 to 15 minutes. The peak effects hit around 20 to 60 minutes in, and the main noticeable effects, they last roughly 1 to 2 hours.
Okay, but here's something really crucial I saw in the sources. Even though those main effects might wear off in, say, 2 hours,
Yeah.
the drug itself is actually still active in your body for much longer, like 6 to 12 hours, that half-life thing.
That's exactly right. A really vital point.
Yeah, seems critical if someone's thinking about redosing or, taking something else. Your system's still dealing with it.
Precisely. Physically, people often report feeling numb, that analgesia or ataxia basically, losing some motor control, feeling clumsy.
Right.
You might also see a slightly faster heart rate, pupils get wider, maybe some slurred speech. Less common, but definitely more serious, are risks like slowed heart rate or breathing.
Especially
Especially if it's mixed with other things that slow your system down, like CNS depressants. And that loss of coordination increases the risk of accidents too, obviously.
Right. So beyond the physical, what about the headspace, the sort of emotional or psychological side?
Well, that disconnected feeling is key. But alongside that, people might experience euphoria, sometimes quite profound spiritual feelings, or just really abstract ways of thinking.
Interesting.
Sensory perceptions can get distorted too. Confusion is possible, even out-of-body type experiences, and visuals definitely happen for some.
Okay, but there are downsides too. Potential negative psychological effects.
Yes, definitely need to mention those. It's rare, but severe things like paranoia, intense confusion, disorientation, even delirium or psychosis can occur. Wow.
And psychological dependency, wanting to use it compulsively, that's a risk as well.
Yeah.
But probably the most concerning long-term physical effect we see mentioned, especially with frequent heavy long-term use, is something called ketamine bladder syndrome. It's a pretty severe degeneration of the bladder lining. Really nasty stuff.
Oof. Okay, so knowing all this, how can that knowledge help people make safer choices if they do encounter it?
That's where set and setting come in. Our sources really emphasize this.
Right. Set being your mindset, how you're feeling physically and mentally.
Exactly. And setting is your environment, where you are, who you're with. These massively shape the experience, whether it feels positive or, goes sideways.
So practical tips would be?
Key things are, be with people you trust, who are ideally sober, maybe wait about 30 minutes after eating, and crucially, start with a really small amount.
Because the dose varies so much. Hugely. What affects one person might be overwhelming for another. Doses can range from 15 milligrams up to 300 milligrams or more, so start very low. And wait at least 2 hours before even thinking about redosing. Give your body time.
Makes sense. And what about mixing it with other drugs? Any big warnings there?
Oh, absolutely. Some combinations are just plain dangerous. Alcohol is a big one.
Even a little.
Even low doses with ketamine can cause bad nausea and vomiting. Higher doses together, that's getting into really serious territory.
Yeah.
And mixing with other depressants, things like GHB, opioids, benzos, that combination can lead to losing consciousness, severe breathing problems, respiratory failure. It can be fatal. Seriously risky.
Okay, so avoid depressants. What about other stuff?
Stimulants.
psychedelics.
Be cautious there, too. Stimulants like amphetamines or cocaine can push your blood pressure up when combined with ketamine. Mixing with psychedelics like LSD or mushrooms can make the whole experience way more intense, sometimes unpleasantly so, and things like MAOIs also significantly ramp up the effects, so caution is key.
Right. Let's shift to some practical stuff like drug tests. What about roadside police tests?
Okay, so typically the saliva tests police use roadside. They don't specifically look for ketamine itself. But, and this is important, ketamine on the street is often cut with other things, and those might show up. Plus, driving while impaired by any drug, including ketamine, is illegal.
Good point. So how long should someone wait before driving?
The advice is usually at least 24 hours after a single dose. Longer if you've taken more or redosed. Best to err away on the side of caution.
Got it. And workplace testing.
Yeah, employers can test, generally under occupational health and safety laws, but it needs to be part of a clear policy, reasonable, and usually based on a risk assessment of the job.
And how long does ketamine stick around for those tests?
Detection times vary. In urine, it's typically detectable for maybe 1 to 4 days. Blood tests, usually up to 2 days.
And hair?
Hair follicle tests go back much further, potentially up to 90 days, so that's quite a window.
Okay. And what about pill testing or drug checking? Can you test ketamine?
Well, proper lab quality testing services are still pretty limited in places like Australia, but there are DIY reagent test kits people can use.
Like the color change ones.
Exactly. Kits like Mandolin should react with ketamine, causing a color change, whereas Marquis and Mech reagents typically shouldn't react. But these kits have limits, you know? They can suggest what might be present, but they can't tell you purity or if there are multiple substances.
Oh, still a bit of guesswork involved.
Pretty much. Which really brings us back to the main point. It's an unregulated market out there. You just don't know for sure what you're getting, the purity, the dose.
Right.
So practicing harm reduction, knowing your substance as best you can, knowing yourself, your setting, it's absolutely essential.
So wrapping this up, what does this all really mean for you, the listener? We've covered a lot, ketamine's quite unique effects, the risks involved, and how information can lead to safer choices.
Yeah, and I think connecting it to the bigger picture, it just really highlights that knowledge is power, especially when you're dealing with substances where there's no quality control. Thinking critically, trying to understand what might actually be in something, it's paramount.
And a final thought, maybe. When you consider those really severe long-term risks, like the ketamine bladder syndrome from heavy use, how does knowing about such specific, potentially devastating consequences maybe shift our view on harm reduction generally, or even drug policy? What stands out to you from this deep dive today?
It's definitely worth thinking about. We'd encourage listeners, check out your local Department of Health website, look for any drug alerts or warnings in your area, and always remember the basics. Know your body and mind, that's your set. Know your environment, your setting, and know your drug practice harm reduction.
That's our deep dive for today. We hope you feel a little more well-informed.